All right, let's jump right in. For literally hundreds of millions of people around the globe, chronic spinal pain isn't just a nuisance, it's a daily reality. But what if the very words we've been using to describe this pain have been part of the problem all along? Today, we're going to break down a pretty revolutionary new framework that's changing how doctors understand, classify, and, most importantly, treat this incredibly debilitating condition.
So, before we get to the good stuff, the solution, we have to understand the old problem. And it boils down to a common diagnosis that wasn't just a little unhelpful, it was frankly deeply flawed.
I mean, just stop and think about that for a second. You go through a major surgery, you're hoping for relief, you're hoping for a new start, and the official medical term for your outcome literally includes the word failure. That was the harsh reality for so many people. And there it is. The term was failed back surgery syndrome, or FBSS. Even researchers and doctors themselves have called it misleading and pejorative. I mean, think about it. It puts the blame squarely on the surgery, it suggests you've hit a dead end, and it does almost nothing to actually describe the incredibly complex pain the patient is still feeling. And here's the crucial point. The pain wasn't always because of the surgery. A lot of the time, the surgery just didn't manage to fix the pain that was already there. So that FBSS label, it was a total roadblock. It gave doctors and patients no map, no direction for what to do next. Something desperately had to change. So how do you fix a problem that's baked right into the language we use? Well, an international task force, a real dream team of pain specialists and neurosurgeons, they all came together to do just that. They came up with a new concept, a new name, and really a whole new way of thinking about this. And this is it. Meet Persistent Spinal Pain Syndrome, or PSPS for short. It was introduced back in 2021, and the beauty of this term is that it's completely neutral. It takes this big picture, holistic view of any chronic pain that comes from the spine. We're talking your neck, your mid-back, your low back, and it finally gets rid of that unhelpful, demoralizing blame game.
Okay, so the new system starts out with a really simple but really smart first step. It splits PSPS into two basic types. Type 1, or PSPS-T1, is for anyone who has persistent spinal pain but has not had surgery for it. And Type 2, that's PSPS-T2, is for people who have had that surgery. It seems simple, right? But this one distinction creates two totally different pathways for diagnosis and treatment right from the start.
But this is where things get really powerful. PSP is the big umbrella, the framework, but the real breakthrough is in digging deeper to figure out the type of pain someone has, the hidden mechanism behind it all. It's no longer just about where it hurts, it's about why it hurts. So first up is what's called nociceptive pain. This is the most straightforward kind. You can think of it as pain from actual physical tissue damage, like a strained muscle or an arthritic joint. It's basically your body's alarm system working perfectly. It's ringing the bell to tell you, hey, there's a problem right here. And knowing that means treatment can focus directly on healing that tissue. Second, we have neuropathic pain. Now, with this type, the problem isn't the muscle or the joint anymore, it's the nerves themselves. The source of the pain signal, the wiring, is damaged. So, sticking with our alarm analogy, the wiring in the house is faulty, and it's sending out false alarms. This is so critical because treatments for this kind of pain have to target the nerves, not the tissue around them. And third, there's nociplastic pain. Now, this one is probably the most complex and honestly one of the biggest breakthroughs. In this case, there's no clear tissue damage and there's no obvious nerve damage either. Instead, the entire pain processing system, the brain and spinal cord, has changed. The alarm has become hypersensitive. It's going off without any real trigger. Understanding this opens the door to totally new therapies that aim to basically recalibrate the whole nervous system. So you've got this new framework, PSPS, and you've got these three different pain mechanisms. How does a doctor actually put all this information together in a useful way? Well, they use a new precision toolkit that combines everything we've just talked about. It's called the PAMC scale, and you can think of it like a 4-part diagnostic code that cracks the case of each person's pain. Let's break it down. P is for the PSP type. Is it type 1 or 2? A is for the anatomical location. Is it the neck, the lower back? Does the pain radiate down a leg? M is for the dominant pain mechanism, nociceptive, neuropathic, or nociplastic. And finally, C is for certainty. How confident is the doctor? Is it a possible, probable, or definite diagnosis? Put it all together and you get this incredibly detailed, specific fingerprint for each patient's pain. And look, this isn't just some academic exercise to create fancy labels. This new code translates directly into a profound, real-world impact on how patients are treated and ultimately on their outcomes. And the need for this could not be more urgent. Just let this number sink in for a second. 619 million. That's how many people were living with chronic low back pain in the year 2020 alone. And that number is only expected to grow. Finding better solutions isn't just a good idea, it's a global imperative. And here is where you can see the shift in action. A traditional kind of vague diagnosis like lumbar facet-mediated pain gets transformed into a precise code, P1A5M3C3. Just by looking at that code, a doctor knows everything. It's PSPS type 1, so no prior surgery. It's in the lower back, the mechanism is nociceptive, coming from tissue damage, and the diagnosis is definite. It's really the difference between a rough pencil sketch and a detailed architectural blueprint for treatment. So, what's the big payoff here? Why does this all matter so much? Well, this level of precision means doctors can finally select the right therapy for the right patient and their specific pain mechanism. This can help reduce the number of unnecessary and repeated spinal surgeries. It can guide doctors toward less invasive treatments like neuromodulation for someone with neuropathic pain. And the ultimate goal, the whole point of all this, is to get patients more effective, personalized, and long-lasting relief.
Which really leaves us with this final thought. By throwing out a negative, unhelpful label and replacing it with a precise diagnostic code, this new approach completely changes the conversation around chronic pain. And it raises a really hopeful question. By cracking the code of pain, can we finally stop just chasing the symptoms and start targeting the true underlying source of why a person hurts?